Good afternoon. My name is Joshua Rue, and today I am going to be doing the Musculoskeletal, Neuro, and Bedside Neuro health assessments. And I'm joined once again by my patient, Caitlin. So starting off today, we are going to start with the musculoskeletal health assessment. And just for the purposes of this video, I'm going to be doing the inspection and palpation of each of the joints as I test for range of motion. What I'm looking for in the inspection and palpation is any odd swelling, any differences in the contour. The joint should be well rounded. There should be no swelling, no signs of any odd masses such as fractures or dislocations. And of course, checking the color to make sure it's the healthy pink color. And of course, checking for the 4 T's: texture, tenderness, temperature, and turgor. All right, so starting off, we're going to take a look at our temporomandibular joint right here in front of your ears. Just gonna lightly palpate. And for testing range of motion, can you open your mouth? And close, yeah, I know, sorry, with the mask in the way, it's a little difficult to see, but everything is looking good there. Next, we're going to take a look at the cervical spine, which runs down the back side of the neck. And which, can you touch your chin to your chest? Good. Can you turn your head right? Good. And turn your head left. Good. And right now, she has active range of motion. She can turn or move her joints freely. If she was having any difficulties and I had to help her achieve full range of motion, that would be passive range of motion. All right, so next we're going to take a look at the shoulders. So if you could raise your arms out to your side. Good. Kind of raise them above your head. Kind of just do some circles and then reach them out in front of you. Good. It's looking good there. Next, we're going to check the elbows. So we're going to start on the right arm, and can you flex for me? Good, and extend. Good. I'm going to check on the left arm, flex, extend. All right, then I'm going to move to the wrist and the hands. So here I'm going to check for supination and pronation. Supination would be turning the hands out like this. So if you could turn both your hands out like that for me, good. And pronate, turn them over like that. Good, and now just try, making a fist, turning your wrist a little bit, flexing your hands. Good, everything is looking good there. All right, next we're going to do the Phelan's test. This is a test for carpal tunnel. And to do this, it's like the opposite of praying. How we normally pray like this, she's going to put her arms like this, and she is going to hold it for 60 seconds. She's not really going to hold it for 60 seconds, but she would normally hold it for 60 seconds. And if she experienced any burning or numbness in the hands, that would be a positive sign for carpal tunnel. You can relax her hands. All right, and for the next one, I'm going to take her arm, and if you could turn it over for me. And the median nerve runs right down the middle of her arm right here, right about the wrist. I would just be tapping that. That would be the Tinel sign. And if she did have carpal tunnel, that would cause some burning or numbness in the hands. Any numbness or tenderness?
Nope.
All right, looking good. All right, for the next one, we're going to test the hips. Since she's already seated, that is a sign of full range of motion in the hips, but just to double check, I'm going to put my hand here and see if she can raise it against pressure. Good. And the next one. Good. All right, and moving on, we're going to check the knee. So if you could, sorry, we have a pup here. So if you could just extend and flex for me. Good. And with the other the other leg, my apologies. Everything is looking good there. And while your feet are out, I'm going to test.
You want to take my shoes off?
Oh, well, for the time being, yes.
Oh.
All right. And if you could just extend your leg, I'm going to check, palpate around the ankle and the toes. Can you plantar flex, which is put your foot down like you're pushing on a gas pedal, good. And dorsiflex, put it towards your leg, good. Can you squeeze your toes? And can you rotate? Good. And now on the left leg, plantar flex and dorsiflex, squeeze the toes. It doesn't really matter, just making sure you have full range of motion. All right, excellent. And palpating as I go. And the last thing we're going to check is your spine, the thoracic and the lumbar. So if you could stand up for me real quick. And just from rotating from your waist, turn to the right, turn to the left, kind of lean back a little bit, and then try to touch your toes. All right, and full range of motion there. All right, and now moving on to the neurologic system. The first thing I want to test for is the level of consciousness, and I'm going to talk you through this one. We determine the level of consciousness by looking at the Glasgow Coma Scale, in which you measure their response to their level of alertness if they have their eyes open. You look at their motor skills, their ability to follow instructions, and you look at how they answer questions. So starting off, just taking a look at our patient here, her eyes are open naturally, so that would be a 4, which is the maximum in that column. Now, if she had her eyes closed and I had to say her name in order for her to open them, that would be a 3. If she had her eyes closed, I tried saying her name and she didn't do anything, and I had to pull on her earlobe to wake her up, that would be a 2. And no matter what I did, if she would not open her eyes, that would be a 1, and that is the lowest you can go. All right, and next I would try by asking her question. And for the sake of this, we're going to say we're in the hospital. So where are you right now?
In the hospital.
You got it. Now, there could be a level of, she could answer the question appropriately, but just be confused about where she actually is. So an example would be saying like, where are you? And she doesn't say the hospital. And then there could just be a completely inappropriate answer to the question, such as like I ask, where are you? And she says, I'll have a medium iced caramel, please. And then there is just the incomprehensible, in which it's just, if I ask her where she is, she just mumbles and it's just a stream of just letters that make no sense. And then a 1 would be if when I ask her where she is, she doesn't answer at all. And the final thing we check for is the motor response. And that's just the ability to like follow basic commands. So if I tell her to put her arms out straight, good, that would be a 6, which is the best you can get. And localized to pain, that would be if like I was trying to get a response from her and I pinch her finger, she grabs towards it like that. And that would be a 5. Withdrawals from pain would be if I pinch her finger and she yanks it away, that would be a 4. Flexion to pain would be if she is lying down and she is like this in the bed. And then there is extension to pain, in which she is down like this in the bed, not moving. And then there's also where there's just no response at all. All right, and the maximum score is a 15, and the lowest you can get is a 3 on the Glasgow scale. And she is looking fully alert, so that would be a 15. All right, for the next, we just want to make sure she's oriented to who she is, where she is, and what time it is. So what is your name?
Caitlin Carroll.
You got it. And you know where you are?
At my house.
Yeah, or the hospital.
Oh, sorry.
And do you know what date it is?
It is June 5th, 2020.
You got it. So that's looking good there. And we're going to test her short and long-term memory. Short term, what did you have for lunch today?
I had a chicken tender and some grapes.
Yum, yum. And for long term, I would ask her something maybe about a family member, something I can back up. Maybe like, what was your date of birth?
11/5/1995.
Good, good. All right, next we're going to check her motor function. And for this, we're going to need her to get up a little bit. Just walk around. Just walk around a little bit in front of the camera.
Okay.
Yeah. And I'm not seeing any shuffling, any limping. It's looking like she's moving around at ease. And can you walk with one foot in front of the other, kind of like they do when the police pull you over? Not that you've been pulled over. All right, good. Showing good signs of balance. And finally, we're going to do the Romberg test, and that is when you're going to close your eyes, and you're just going to stand there. And I'm going to look for any unusual swing or any signs she's going to fall over, and she's looking good there. All right, and next we're going to check her coordination and some skilled movements. So for the first test, we are going to do rapid alternating movements. So for example, pronation, supination. And if you could just do that for me until I tell you to stop. All right, that's looking good. And for the next test, we're going to do the finger to thumb. What she is going to do is she's going to touch each of her fingers to her thumb and then back, and then just keep doing that. All right, that's looking very coordinated. Next, I am going to do the finger-to-finger test. And you are going to touch your nose and then touch my finger. Good. And then I'm going to move over here. I'm just going to move around just to see if you stay coordinated. Good. Excellent. And then you're going to do the finger to nose test, in which she's going to hold out her arms like this and then alternate arms touching the nose. Good job. And then for the next one, normally we'd be laying down. Unfortunately, we kind of have limited room here. So what we're going to do is, if you could just take a seat for me, you're going to do the heel to shin test. You're just going to hold one leg out. Then you're going to take, just hold that leg out there. And then you're going to take your right leg and you're going to put it around where your ankle and foot are.
Like this?
Yes. And you're just going to go up with the back of your heel up your shin. Let me zoom in on this real quick.
Your fingers in the way.
I'm not good at this. Is it looking good now? Yeah, all right, yeah. All right. And next we're going to check her sensory function. So we're going to check the spinothalamic tract. For this we're going to use a cotton ball and just do some light touch. So for this one, I'm going to have you close your eyes and let me know when you feel the cotton pad touching you.
Feel it. Now.
Good.
Now. 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 Now.
Excellent. And now we are going to do the pain test, or the sharp and the dull test. I'm going to have you keep your eyes closed, and you are going to tell me whether what you feel is sharp or dull.
Sharp?
It's dull, actually, so I was pushing too hard.
Wait, are you gonna show me them first, or?
I'm using a toothpick and a Q-tip.
Oh, okay.
So you can close your eyes again.
Can you press a little harder? Dull?
Yes.
Sharp.
Yep. And you always want to go bilaterally, check both sides.
Sharp. Sharp. Dull. Dull.
Excellent. All right, and for the next part of the exam would be the posterior column test. For this, normally I would need a tuning fork, but what I would do is I would tune the tuning fork, and then I would hold it near the bony prominences of the fingers right here and of the toes. And I'll check the vibration. And next we're going to check position, or kinesthesia. And for this one, I'm going to have you hold your hand out for me, close your eyes, and I'm either going to move your finger up or down, and you're going to tell me which way I move it. I'm going to hold your finger from the side.
Up. Down. Up. Up.
Good. All right, and for the next part of the exam, I'm going to check tactile discrimination, in which I'm going to start with stereognosis, or it's also called the coin test. I'm going to have my patient close her eyes. She's going to hold her left hand out in front of her, and I'm going to put an object in her hand, and she's going to tell me what it is based on just feeling it, not seeing it.
Is this your pen light?
It most definitely is. And hold out your right hand for me and tell me what this is by feeling it.
The cotton pad.
You got it. All right, and keep your eyes closed for me. For the next part, we are going to check graphesthesia, in which I am going to trace a number on her hand, and she's going to tell me what number it is. So you can hold out your right hand for me.
Can you do that again?
Yeah, I'm sorry, I started in one direction and completely changed.
Is that a 9?
Yep, you got it. All right, and for the final portion of the tactile discrimination, I am going to poke her in a certain area of her body, and she is going to, with the other hand, point to where I poked.
Oh.
Yep. Good. Excellent. And next I'm going to check her reflexes. So normally for this I would need the reflex hammer, but for the purposes of this video I'm just going to show how and where I would normally hit. So first we're going to start off with the biceps. I would take her arm, put it on my forearm, and put my thumb here, and then I would take the reflex hammer and hit right at the spot of my thumb. And for the next part, we're going to test the triceps. You can hold your arm out to the side for me. I'm just going to put my arm like this, and just you could relax your arm down. Actually, I'm sorry. Yeah, there. Just relax your arm down. And then right here above the groove of the elbow, I would hit the reflex hammer, and it should go out like that. All right, the brachioradialis, you could hold your arm out again for me. All right, and I would hit just below the wrist, and I should see some flexion and tension in the forearm around the brachioradialis. And the next part, I will go to the patellar or the knee. This is the famous one where I hit not too low or not too high, right at the tendon here. If I hit it, it should go out and extend. Next, I will check the Achilles or the ankle jerk. There, I will dorsiflex your foot, and then I would hit at the back of the Achilles, and it would want to plantar flex. And for the second to last part of this, I will be testing for clonus, which would be excessive movement or hyperactivity in the leg muscle. Have you plantar flex and then dorsiflex for me. And I'm going to hold the dorsiflex, and I would observe it for a period, and if the leg started shaking or the muscle just kept moving, that would be a sign of clonus or hyperactivity in the muscle. And for the final part of the neuro exam, for the reflexes, I'm going to be checking the plantar or Babinski. So what I'm going to have you do is hold your foot out. I'm going to trace an upside down J. And her foot should be plantar flexing, and if it dorsiflexes and her toes fan out, that is not what we're looking for. All right, and for the bedside neuro portion of this exam, I will be just talking you through what we would do. First, we would assess the level of consciousness, or the APU, see if she is alert. Just check the eyes, make sure she's awake and alert. If her eyes are closed, I would then go to verbal stimuli. I would see if she responds to me calling her name. If that doesn't work, I would try pinching an earlobe or pinching a finger, pain stimuli. And then if that doesn't work, she would be unresponsive. And then I would be checking her orientation, again asking her, what's your name? Do you know where you are right now? And do you know what the date is? And then I would be checking her motor strength and her hand. I would hold out my two fingers and have her grip around, and if it is normal or as it should be, I should not be able to move my fingers out. And for the leg, it'd be kind of like the iliopsoas muscle test we did last week, I would have her leg extended and I'd be pushing down and she'd be pushing against my leg as I push down. And checking the sensory response, again, I would be taking a cotton pad and touching it over various parts symmetrically and bilaterally across her body, and she would be telling me if she felt it. And then for the superficial pain, I would be doing the sharp and dull test again. And then finally, we would be doing PERLA, which we did in the eyes, ears, and nose, mouth, and throat assessment video. I would be taking a look at her pupils, making sure they're symmetrical and round. Then I would be taking my pin light, seeing if they're responsive to light, they constrict when I get close. And then I would be checking the accommodation. When she's staring far away, her eyes should dilate. And when I move closer to her, her eyes should come together and they should dilate. They should constrict. And that concludes this video. Thank you.